Welcome to Perimenopause Hell. This is a video about medicines that you can take other than HRT to relieve the symptoms of perimenopause. Now, some women don't want to take HRT, as in hormone replacement therapy, because they're aware that it increases the risk of breast cancer. Now, elsewhere in the group, we discuss what these risks are exactly and talk about the statistics. And many of you may decide that given the severity of your symptoms, it's well worth you taking HRT. But some women really worry about the risk of cancer and they have decided they don't want to take it. And to tell the truth, there are some doctors who do not want to prescribe it either, which may account for some of you seeing that your doctors really want to avoid giving you HRT and they will suggest other things first, or they will just try and wriggle out of giving you anything for your symptoms. Now, that's unfortunate because really there needs to be a frank discussion of the risks and whatnot. Now, there are some women also who carry genes for breast cancer, or they've had a close relative, for example, a mother or a sister who's had breast cancer, so they know that their chances with HRT are not good. Now, there's also the vexed issue of what HRT is actually good for, and really it's best for what are called vasomotor symptoms, so hot flashes, night sweats, hormonal insomnia, that type of thing. If you have other symptoms, for example, you've got depression, you have anxiety, you're itchy, you've got allergies, you've got a number of other odd symptoms, maybe even joint pain, then there are other treatments that may actually work better for you than HRT. Also, there are some of us that react very, very badly to the progesterone that is now part of HRT, and you cannot take HRT without progesterone if you still have your uterus. So unless you've had a hysterectomy, that's it. You have no choice but to take the progesterone part of HRT. I can't take progesterone because it makes me feel extremely depressed. Other people cannot take it because it gives them PMS type symptoms. Progesterone is the pregnancy and the PMS hormone. So despite the fact that it's got the reputation as being the best thing now to treat perimenopause symptoms, for some of us, it's exactly the wrong thing. So some women can't take estrogen either. For example, if they have migraine with aura or if they have various other risks for it. So anyway, let's get on to what exactly is available for you if you cannot take HRT. There's a medicine called clonidine, and this is a blood pressure medicine. That's what it was invented with the intention of treating. It was then noticed that it helped with both headaches, as in migraine headaches, and hot flashes. So basically, if that's your issue, it's one of the things that you can try. The suggested dose here, which I've got from NICE, which is the National Institute of Clinical Excellence in the UK, suggests 50 to 75 micrograms twice daily. NICE these days host the BNF, which is the British National Formulary, which is the list that your doctor looks at to decide the dose that he or she should give you for whatever problem it is that you have. So you'll notice here there's a dose suggested for hypertension, which means high blood pressure, and there's doses here for menopausal symptoms and headaches. So these are the doses that are suggested in the UK. You might have a different dose suggested if you're elsewhere in the world, but it will probably be similar. Now, one thing you'll notice about clonidine is the pills are very, very tiny, which is kind of the opposite of tranexamic acid, where the pills are massive, real horse pills. So careful not to drop them because they are extremely teeny-weeny. There's a website that you can go to called drugs.com, and on this website, you can enter in your own opinions as to medicines you've tried, and you can read other people's reviews of it. So the rating that clonidine gets for the treatment of perimenopausal symptoms is 7.1 out of 10, which I don't think is bad. I think actually you'd find the opinions on HRT quite comparable. People do give up on HRT. They can't stand the side effects that they get because basically it's not like your own hormones. So one of the reviews here, left on May the 20th, 2014. Why does the medical community not widely suggest this medicine to women who are suffering from disabling hot flashes and not sleeping? I went to my gyne and I was told that my options were hormones, antidepressants, or gabapentin. None of these were acceptable for me for various reasons. I went to my general doctor who saw how serious my symptoms were and he prescribed this. I take 0.05 in the morning and 0.05 before bed. The first night I took it, I slept like a baby, something I have not done for nearly a year. And I didn't have one single flash all night. I got past the dry mouth and drowsiness, and now I have no side effects of my old self again. This saved my sanity and gave me my life back. So that's 10 out of 10 from that particular person. Somebody else here called Kira, 2019. I've been on clonidine for 2 months at 25 micrograms morning and night. I tend to have low blood pressure and low heart rate, so my GP wanted to be conservative, which means the GP wanted them to be careful with the dose. So they started on a low dose. For me, it has revolutionised my life. I have suffered flushes for over 10 years, and due to having had hormone-positive breast cancer, could not take any HRT. I have occasional flushes, but nothing like I used to, and my anxiety associated with the flushing has also reduced. This was immediate. So grateful to have found this drug. Of course, not everybody has such a positive experience, but in general, the reviews of this are quite good. I think it's something worth trying. I take it myself for blood pressure and probably have noticed being a bit less hot. Not that I'm particularly at the stage yet where I'm having mad hot flushes. There's another medicine that I want to mention because one of the symptoms we come across very much in the group is depression. Bupropion, otherwise known as Wellbutrin, is a kind of unusual antidepressant. It's not an SSRI, which are the commonest that you'll see recommended. It doesn't really help with hot flashes or night sweats. I'm mentioning it purely because it's an antidepressant that does not have the usual side effects that you notice with SSRIs. So it doesn't have the sexual side effects, which are really common with other antidepressants. It doesn't cause weight gain either. And it can help with nicotine withdrawal. So if you're desperately trying to give up smoking, that's another good thing about it. But many women in perimenopause are struggling with their libido. So this is something that's not going to affect you sexually. So if depression is your main problem, this is a good choice. But we're next going to go on to the antidepressants, and by this we mean the SSRIs that most people are familiar with just for depression. But you may know they can be prescribed for hot flashes and the vasomotor symptoms. One probable mechanism by which they work is to reduce your stress levels, and that causes fewer hot flashes to happen. There is another video on the website which describes the possible mechanism by which women have hot flashes, and so anything that acts as a sedative and makes you a bit less stressed out and reduces your adrenal hormones is a good choice. So paroxetine is the only one that's actually approved by the FDA in America for treating hot flashes, but the others can also be used what's called off-label. So that isn't their primary purpose, but it is recognised that these medicines can also help. So the others are venlafaxine, escitalopram, and citalopram. So for women whose major perimenopausal symptoms also include depression and or anxiety, these are a good choice. Doses to treat hot flashes only are lower, which means there are fewer side effects. So a while back, The makers of paroxetine decided that they would market a lower dose of it specifically towards menopausal women. That's called, I don't know if it's Brisdell or Brisdell, but anyhow, that's how it's marketed. And if you look that up on drugs.com, the rating of this medicine for the treatment of hot flashes is 7.3 out of 10, which once again is quite good. You do notice that further down, you can see that some people were not happy with it. It's probably due to the typical side effects that you get with SSRIs, and sexual side effects and weight gain are some of the things that people are usually unhappy with there. So some of the reviews here from people who found it very helpful, and the dose here was 10 milligrams daily. This was 2021. I'm almost 63 years old and suffer severe hot flashes. They've never stopped unless I was taking hormones. I tried natural supplements, but no relief. My primary care manager refused to prescribe any more hormones, but she did suggest paroxetine. I got the prescription filled out, but did not take it when I found out it is Paxil. I had taken Paxil years ago for depression or stress. It did not go well due to many reasons. But after no longer being able to deal with the hot flashes, night sweats, no sleep, I started, with a lot of research, the paroxetine, 10 milligrams every morning. And after 2 weeks, I can say that it is going well, very well. Hot flashes have almost completely stopped. No more waking up in a sweaty puddle. I sleep through the night now. There is no drowsiness or mood swings, no fogginess. I feel so much better, remarkably so. It was not immediate, but has gotten better day by day. Okay, one from a bit earlier, 2013. I was a little afraid to use the medicine. I read a lot about it. Just starting paroxetine. Been taking the medicine for 2 days. I already noticed the difference with my hot flashes and night sweats. I used to throw the covers on and off, but now I keep the covers on and I am not as hot anymore. I will continue to use it. On to another medicine now, which seems to be very popular in Australia. This information I found from the Government of Western Australia Health Service website, mentioning a medicine called oxybutynin. So oxybutynin is a medication used most often to relieve an overactive bladder. However, it has also been shown to relieve menopausal hot flushes and sweat in almost 40% of women. Oxybutynin may be used as a patch or a tablet. So this is a research study that I found on oxybutynin, and the reduction in hot flashes for people on the dose of 2.5 was 70%, and for those taking the higher dose of 5, that was 86%, which is, it's pretty good, isn't it? So if you have urinary problems as well, that's a winner for you, because it doesn't only help with the urinary problems, i.e. People who feel that they need to go to the toilet all of the time, and the incontinence that it helps with. It also helps with sweating. The medical name for sweating too much is hyperhidrosis, so it helps with that too. Doses for treating hot flashes are once again much lower than those taken for urinary problems. The doses are generally around 2.5 and 5 milligrams twice daily. You can take the medicine as a tablet, or you can take it as a patch to stick on your skin. Interestingly, I noticed that you are not supposed to wear the patches somewhere where they're exposed to sunlight. You have to put them somewhere where they aren't, because that affects the functioning of the patch. Side effects on lower doses are rare, but dry mouth and sleepiness is fairly common. So once again, this is a slightly sedating medicine that's also reducing your stress levels as well as dealing with the hot flashes. Last one now. These are the antiepileptic drugs like Gabapentin, Neurontin, Lyrica, or that sort of thing. So if you also have a disorder like fibromyalgia or arthritis that affects the functioning of your nerves. These are quite helpful for you. They are both what are called anti-seizure drugs that were developed for epilepsy. So they work by dampening down the nervous system. They also have a sedating effect, like most of these medicines do. A lot of women in the group are alarmed when they hear about the use of gabapentin, in much the same way as they're alarmed by the idea of using antidepressants. But once again, the doses of these are much lower than you would be taking if you had some sort of problem with your spine and you were taking it for nerve pain. Those doses can get up to quite high levels, but of course they're treating a very serious problem. So the doses for treating hot flashes are much, much lower. They also help a bit with sleep because they're sedating. Now, along with all of these medicines, especially the antidepressants, withdrawal symptoms will happen if you attempt to stop taking them right away and you do a cold turkey with them. If you want to stop taking these medicines, you have to draw up a plan and you have to wean off the dose of the drug slowly. So you reduce the dose slowly over a number of weeks, months even, just to make sure that you avoid those nasty withdrawal symptoms. A lot of medicines work this way. It's nothing new. I've been in that situation before. I'm a patient. I have a lot of autoimmune illnesses. So I don't think you should be really scared off using these medicines. They can be very helpful. And gabapentin in particular can help with more than just hot flashes. As we said before, people who have aches and pains and fibromyalgia, it can help with that. It can also help a lot with women who have the itching symptom. So if you have what's called formication, gabapentin can reduce that because basically it dampens down your nervous system, and that's what's causing the itching is overactivity of the nerves in your skin. So gabapentin and the other drugs in that class can really help with that. Since they are sedating, they can help a lot with your sleep if you take them in the evening. And that's probably the best way to take them anyway, so that you're not so groggy in the daytime. Any initial problems that you have with the sedating effect can usually be solved by taking it early in the evening, say around 6 p.m., and then you're really feeling tired by around 10 o'clock. And in the morning, that symptom's gone. And the symptoms will get better over the course of the amount of weeks that you're taking it if you have irritating side effects. So after, say, 2, 3, 4, 5, 6 weeks, it will slowly get better. Side effects are more problematic at higher doses. Studies show that 900 milligrams daily resulted in a 54% reduction in hot flashes after 12 weeks of use. That study was on 420 women, so that's quite a nice size for a study. So this particular study said the results of this randomized, double-blind, placebo-controlled trial accord with those of our pilot study of menopausal women. There was a 46% reduction in the hot flash severity score with gabapentin, 900 milligrams a day, compared with a 54% reduction versus placebo reported in postmenopausal women treated with gabapentin, 900 milligrams a day for 12 weeks. So it got better over time. And you can read the rest of that at your leisure by stopping the video. And it basically says there as well that when you increase the dose, the control of the hot flashes gets better. But obviously with that, the side effects are likely to get worse if you do suffer with side effects. This is somebody in the group who chimed in one time when people were saying, "Oh, don't take that drug, it's awful. My nan took it and it made her so well." Anyway, this person says, "I've taken it for years and years for nerve pain. I've started and stopped it many times over the years and never noticed any side effects. When I read that it can help with night sweats, I tweaked when I took them, so I was taking one right before bed. I've been completely amazed. I already knew it worked wonders for nerve pain, but it has stopped my night sweats. Like I haven't woken up sweating to death once since I started taking one before bed. I can't recommend this drug enough. I literally couldn't imagine life without it. It works great and I don't have any side effects. So that's a very happy customer there. Also, this is the one that actually gets the best rating on drugs.com with an average of 8.6 out of 10 for the user reviews for the treatment of hot flashes. Couple of reviews here. Started taking this for hot flashes a couple of weeks ago. I'm on 300 milligrams twice a day and it's wonderful. I would sometimes get more than 4 hot flashes per hour. I felt like a chameleon. I had no idea how nice it is to be almost completely hot flash free. I'm post-menopause at 48 and started having flashes at 37. After a while, it becomes a fact of life. If I had under 10 flashes in a day, I thought that was good. When I started having 2 to 4 per hour in the afternoons, sometimes more than 30 during waking hours, my oncologist prescribed this. I can't take hormones because of high-risk breast cancer. Gabapentin is giving me my life back. Another review. Having suffered intense hot flushes up to 20 times a day and night for the past 5 years, I'm 49 years old and they were really affecting my life. I am unable to take HRT and was prescribed gabapentin by my GP, gradually increasing the dose up to 400 milligrams 3 times a day. My hot flashes have reduced by 90%, still having the odd one, which is much milder than before, so hardly notice it at all. This medicine, to be honest, has given me my life back. I feel like a new woman. Sometimes I feel a bit lightheaded on these tablets, but nothing too bad, and now sleep like a baby. If you are considering giving these a try, don't hesitate. So that's the end of this presentation. If you like the information, like and subscribe and all that YouTube jazz, and hopefully we'll see you in the group. Tatty bye.